New Health Report is an interesting piece of research that we've sponsored that assessed and gauged the opinions of almost 2,000 stakeholders in what we call the new health landscape. But these include primarily biopharmaceutical executives, managed care executives, payers, physicians, and 1,000 patients with chronic disease. The new health landscape is our description of this very rapidly transforming landscape within the biopharmaceutical industry and the healthcare setting, in which biopharmaceutical companies find themselves under enormous pressure to be productive, to be innovative, and to deliver value at the end of the day, which is measured differently by the different stakeholders. I think it was quite surprising to find that almost 3/4 of stakeholders felt quite optimistic over a 10-year horizon that the quality of pharmaceutical products coming into the market was going to improve. And I think that's actually quite surprising. There's been a lot of negative press about the biopharmaceutical industry, about how the industry is not as productive as it needs to be, a question about whether it's sufficiently innovative to deliver the new medicines into the marketplace that will improve survival, quality of life, very important outcomes. And when we surveyed this fairly large number of different stakeholders, seeing that about 3/4 of them were quite optimistic in this regard is heartening and quite surprising. I think the New Health Report really frames the discussion and frames a point for dialogue to proceed constructively, because it highlights the gaps in perception between the various stakeholders, particularly around this very fundamental concept of value. So if we understand that different, very important stakeholders have a very different notion of what value is, I think that's very important to disseminate and have people understand what other stakeholders' perceptions are in this regard. I think that can lead to furthering the debate and getting beyond this sort of tug of war that is right now focused primarily on cost. We clearly need to get beyond that. We clearly need to address value, but recognizing that different stakeholders have different perceptions around value. Amongst biopharmaceutical executives, 80% of them felt that biopharmaceutical companies understand well the needs of patients. When you ask patients, about 2/3 of them, 67% of them, agreed that biopharmaceutical companies understand their needs as patients. So there is a gap there. It's not tremendous, but it's definitely there. And I think as we repeat these surveys in the New Health Report, it'll be very interesting to see if that gap widens, shrinks, or stays about the same. Stakeholders, maybe not surprisingly, have very different perceptions about value in the healthcare setting, and particularly with regard to biopharmaceutical products. There's been intense focus and scrutiny around this in the healthcare reform process in the United States particularly, and it certainly plays out in the rest of the world as well. And so what we've seen is an intense debate over the, frankly, relatively small portion of healthcare spending that is allocated to prescription pharmaceutical products. In the United States, that's a little less than 10% of all healthcare spending. But of course, some pharmaceutical products are quite expensive. and the debate often focuses around cost. And we saw, when we questioned the various stakeholders, that payers are very focused on cost as part of that value equation. Biopharmaceutical executives were taking cost into account, but focusing more on the outcomes that one can achieve with that pharmaceutical product and the cost input. Patients and physicians varied yet again and tended to focus on the quality of the care that was that especially patients were receiving in the healthcare setting. That's terribly important to patients, not surprisingly, and I think they tend to focus on the quality of that interaction in the healthcare setting far more than they tend to focus on numerical outcomes and immediate costs.